You're very welcome to this video and to this channel. My name is John Campbell. Now, YouTube like you to put up an introductory video on your channel homepage to say what the channel is about. And I thought this was an interesting time to reflect as well. What is the channel about? The background basically to my channel is that I started making videos in about 1990 when I was teaching student nurses, VHS tapes, then DVDs, and then onto YouTube. Started YouTube in it's a long time ago now, 2007 I started putting videos on YouTube. And there we covered a lot of the basic anatomy and physiology, pathophysiology, disease processes, background science, things that all the basic medical students and nursing students around the world would need to know, and people in related professions. But then when COVID came along, what we did, we started talking less to the professional viewer, although of course professional viewers are still welcome and find it interesting, but more to the intelligent lay viewer, someone who's prepared to spend a bit of time, think about these ideas, who might have a background in something completely different, who might be a bricklayer or an accountant, just someone who's interested in health related matters. So what we're interested in is what causes diseases, how diseases present, what's going on in the body, and what are the management strategies for this. Now, of course, we're a YouTube channel. We don't prescribe. And hopefully I don't prescribe, well, of course we don't prescribe drugs, but hopefully I don't prescribe what you should think either. So what the channel is really about is giving you background information so you can think for yourself. Not advising on specifics, but educating on the background so you can think, you know what? I'm going to make an informed decision here for your own thinking, your own education, things that might affect your lifestyle, the lifestyle of those around about you. Informed decision making really is what we're trying to facilitate. Now, in healthcare, we have problems, so we assess problems, we plan what we're going to do about it, we carry out interventions. And then, of course, we evaluate the effectiveness of that interventions. And that's been maybe one of the deficits of recent years in healthcare in the wider perspective, a lack of evaluation. Things have been done, but they haven't always been evaluated as we would like them to be evaluated. So how do we evaluate? How do we assess what is appropriate? What is a good intervention? What's a bad intervention? Well, there's different ways we can do that. One way is we can compare it with underlying science. So if something completely contradicts underlying science that we know about physiology, pathophysiology, it's probably not going to be accurate. We're looking for that consistency there. And we're also looking about how it agrees with published data. How does it compare with the established medical scientific literature? Now, 30 years ago, this wouldn't have been too much of a problem, but now it is a problem because there's also a lot of, these days, there's an awful lot of vested interest goes in to decide what topics are researched, what topics are not researched, how that research is written up, what research is written up, what research is quietly ignored, and the whole thing becomes complicated because there's a lot of vested interest involved. Because basically, to be quite blunt about it, healthcare and health is a I don't know, trillion-dollar industry. If you look at all the adverts you see about health, what you should drink, what you should eat, what you shouldn't eat, what exercise you should take, what training shoes you should wear, before you even go on to considering medications and actual healthcare interventions, you can see that there's a lot of money to be made in this. So what we try and do is give information which is objective and but based on the best interpretation of the science we can. Now, this is my interpretation. Don't always get it right, of course not. If I get something patently wrong, I'll always come back and tell you that whenever that's possible. But basically, it's my assessment of it. And all I can do is look you in the eye now and commit to doing that as well as I can. I'm not paid by any external bodies. I do get some YouTube income. What I do for that is I put an advert at the beginning of the videos, never put an advert during the video. So once that annoying initial advert's been on, you can watch the rest of the video all the way through. So we're trying to compare it with basic science. We're trying to compare it with the literature, allowing for the fact that the literature is incomplete. So, for example, there's been a lot of discussion recently on certain repurposed drugs, which are highly efficacious in a lot of conditions, but there's no money in that. So the repurposed drug is very often not analysed for a new indication, for a new purpose, because the patent has expired and pharmaceutical industries can't make a lot of money in it. So somewhat understandably, they're not prepared to put $10 million into organising the clinical trial. But does this mean we're missing out on huge amounts of medications, for example, that would be efficacious? We can evaluate that. Are there very simple lifestyle interventions that we could make, like improving diet, like exercise, like not eating certain dietary components, like taking maybe some supplements for things which are deficient because of a particular diet in a particular cultural situation, that can make a huge difference to healthcare outcomes? Thinking about these basic things before you start thinking about high-tech interventions. Now, of course, high-tech interventions can be life-saving, but are they always appropriate? Do we really want to be taking some pills every day for the rest of our lives when lifestyle modifications might be as efficacious or more efficacious? So these are the sort of things we think about. And as well as looking at the basic science, as well as analysing the literature, we also take on board expert opinion. And we've been really privileged on this channel to have some world-leading experts in health, in science, come on the channel, sometimes doing interviews, sometimes giving us information, but very often doing interviews, sometimes face-to-face, very often online. But we've been really privileged to get first-hand information from world-leading professors, academics, scientists in a wide variety of fields. And hopefully this is giving you the background that you can put together to try and make your own mind up, to formulate your own thinking. There's lots of people these days saying, you have to think like I think. You must agree with me. If you don't agree with me, I'm going to sanction you. If you don't agree with me, you're somehow stupid. And we can be railroaded into particular ways of thinking. Particular vested interests, particular government agencies might have a vested interest in us thinking in a particular way, down the railroad lines of conventionality. Now, very often the conventional treatments are the best treatments, the best lifestyle measures, but very often they're not. History is replete with this. We saw people for years telling us that alcohol was good for you. Telling us that smoking and nicotine were not addictive. Now, we could talk about those. Alcohol, it's dose dependent. There's no safe dose of nicotine. Smoking's always bad. But we had people who had a vested interest in this saying that nicotine wasn't addictive. Just completely ludicrous. We've got people in the food industry saying that particular foods are good for you, when in actual fact they might be ultra-processed foods. Now, yes, one component of that food might be good, but you need to look at the whole thing. So we're looking at the whole thing, giving this information. And I'll put it together. I'll give you my best opinion, but basically I'm giving you the facts so that you can make your own mind up. Sometimes it's about molecules, very simple things. Sometimes it's about cells. Sometimes it's about tissue. Sometimes it's about organs. Sometimes it's about the whole body. Sometimes it's about our social, cultural context. We believe that human beings are bio, psycho, social, spiritual, physical. We are complex units, and these all interact, and sometimes we're not a unit at all because we depend on others. But again, because we depend on others, this inevitably brings in the fact that there can be exogenous influences on our health. So government policy can affect our health. Political factors can affect our health. Now, we don't go into economics and politics. This is not what the channel's about. But we do take note when this is going to impact on the well-being of individuals. So sometimes we have to look at these bigger factors that are influencing the health of the individual, as well as the bottom, the molecules to cells up. So we look at the bottom up but we also look at the top down with the individual in the middle and their health and well-being there, because there's nothing more important than health and well-being. Talk to someone who hasn't got their health and they will give anything they have to get it back again. And of course, nothing is more precious than human life. We want to live longer and we want to improve the quality of the life. We want to avoid pain as we want to improve our own outcomes, but the outcomes of our loved ones as well. So basically, hopefully I'll give you the information for you to decide. I'm not going to tell you what to think. That's kind of what this channel's about. Now I've done that fairly spontaneously. I have a bad habit of doing this, but I think that kind of explains what we are about. This is for people that are interested in these massively important outcomes and want to think about it objectively for themselves to make their own decisions. It's about empowering people to think objectively and accurately about their own health and well-being without undue influence from external vested interests. That kind of summarizes what we're about. Now, for me personally, what's my background for this? Well, I was a nurse for 45 years, I guess. But I was involved in academia and training for a lot of that time. So I did a lot of research. I did a lot of teaching, and inevitably teaching nurses, and then other people used to come to lessons and watch videos as well. So basically all of the medical people, we've taught dentists and doctors and pharmacists and physiotherapists, and a lot of alternative practitioners have also utilised the materials that I have produced, which is good. As well as my clinical career and teaching career, I've been done a lot of academic work as well. So I did, I started being an academic when I was quite young, really. I did a qualification called a London University Diploma in Nursing, which was actually really hard when I was young. Not many people did that, so I did that. Then more academic stuff came along, so I did a Bachelor of Science degree in Biology and Health Science, and then a Master of Science degree in Health Science, and then a Doctor of Philosophy degree. That's where the doctoral title comes from. In what was it about? My doctoral work was about national and international application of bioscience in healthcare education, and more than that, why is bioscience important? How can relate what's happening to the patient on a macro level with what's happening with the underpinning science, drawing links between the underpinning science and whole people and emergent healthcare outcomes. I guess that was what that was largely about. And also along the way, I've written some books that they're available mostly for free they are free download on PDF. I post a link for that from time to time, so you can download my textbooks, one on physiology and one on pathophysiology. Since I retired from full-time education and academia, I've done some more clinical work. I still travel when I can. We've done healthcare projects done quite a bit of teaching in Cambodia, India, Africa, Kenya and Uganda. We've got ongoing projects in Uganda and Kenya, and educational materials are still used in many countries around the world, which is nice. Books I've written are still being utilised. So that's about me. Now I'm interested in the things I've discussed and the way this is communicated to a wider audience largely via YouTube, via videos, via ebooks, via podcasts, but at the moment mostly via videos. It seems to be the modality, the modality of communication of the moment is videos. People seem to like videos, which is fine. I like making videos. I find it interesting, and I find it interesting the way that you can teach concepts using the video medium to empower people that are listening to make objective, intelligent decisions for themselves. We don't use any gimmicks, no music. Well, sometimes I'll put music on if someone sends some in. We had a poem recently from Mr. John Bow, for example, which was quite moving. But basically, it's not about that. It's not about... I'm certainly not going to try and entertain you. This is not entertaining. There's going to be no dancing, jiggery-pokery with special effects across the page. No background dum-de-dum-de-dum music. It's just about the cognitive content. So I think that's roughly what this channel is about. It's more up to date than the last one that this is replacing anyway, so look out for the videos, search some of the old videos that they're still there. Plenty of interesting material, I think, and hopefully you find it interesting as well and useful. Make your own decisions. Take charge of your own health and of those of your family in the physical, spiritual, social, wider, nationwide, international context. See you on the next video. Thank you for watching this one.